Moving on now, after spending much of its winter in a tight lockdown, British Prime Minister Boris Johnson is all set to announce in the Parliament a roadmap to ease lockdown measures. The roadmap falls under Johnson's accelerated plan to cautiously reopen the economy of United Kingdom. Now, restrictions will be eased step by step across the whole of England at the same time, and the first step of the roadmap will begin on 8th of March, which has been earmarked as the date when all pupils will be returning to classrooms. Now, with this, it will become the first section of society to reopen. Indoor home care centres are also set to resume. Rules on socialising in a public space will be relaxed, and right after the Easter holidays, the second part of the first reopening phase will get started. With more focus on outdoor gatherings, families will be given more flexibility to meet outside, with numbers to be capped at 6. Now, this is what we know as of now, and the second phase of the reopening process will begin mid-April. That will allow the reopening of some hospitality options in limited circumstances. Universities and colleges could get the green light to reopen campuses. As a middle of May approaches, the third phase of the roadmap would start at this point, and pubs and restaurants are likely to open shuttered and indoors with the curbs on number of people. June onwards, indoor social gathering might also be allowed, with a further relaxation of social contact. June could see opening up of much of the hit tourism sector. Now, the authorities have ensured that the gradual reopening process will go hand in hand with the number of coronavirus cases and the simultaneous inoculation drive. More focus would be laid on reducing hospitalizations and deaths and the successful continuation of the vaccine deployment program. The NHS says that they will need to ensure that assessment of risks is not fundamentally changed by new variants of the virus. And remember, United Kingdom has kept pace with the inoculation drive and is now promising to vaccinate all adults by the end of July. The accelerated vaccine rollout will help protect the most vulnerable sooner and enable the easing of restrictions. A rough timeline has been set. People aged over 50 and with those with underlying health conditions will be offered a jab by 15th of April, and by 31st July, all adults should have been offered a COVID-19 vaccine. And we are now being joined by our London Bureau Chief, Mandy Clark, for more on this. What are some of the major changes, apart from what we've just mentioned, that we can expect in this roadmap?
Well, I think where there's a level of frustration is Boris Johnson, just a year ago, was very quick not to disrupt life. Now he's an incredibly cautious Prime Minister. We've seen a step change. He's made it clear that after each a phased lockdown change, that there'll be around 5 weeks in between to make sure that the numbers haven't skyrocketed. And he's really emphasized this is all about data and not dates. And so this is the tentative schedule. But of course, if the data shows that there is a spike in cases, then he will hold the next phase of the slow release of lockdown, because really they've made it clear this is the last time they want a lockdown in the UK. Because of it, it's a very slow release, and that has businesses very frustrated. Of course, the hospitality sector that has been on its knees for the last year is incredibly angry how long it's going to take before they can start welcoming people back indoors. But he's made it very clear it's a cautious approach with the main focus of getting those pupils back to school. So that's why that's phase one. But really, he's not guaranteeing any other of those steps. It will all be based on data. So there's lots of people who are frustrated that it isn't going to be a reopening, but that's the way it is.
All right, Mandy. Also, the authorities have ensured that the gradual reopening process will go hand in hand with the number of coronavirus cases and the simultaneous inoculation drive. What can you tell us about that?
Well, the inoculation drive has been going a lot quicker than expected. And also the take-up has been better than expected. So they have seen that around 80% of people in all the highest risks have agreed and taken up the vaccine offer. They didn't expect such strong numbers, which is a good sign. It means they're a month ahead of schedule, and that's why they're currently looking at the end of July, offering it to all adults. It has been one of the bright spots of the UK coronavirus pandemic. There has been many other issues, but the one thing that has been quite successful is that rollout. And they're also seeing with the inoculation that it does halt the spread as well. And so that was another factor that allows the phased rollout. Around 2/3 of people who have had the vaccine won't spread coronavirus. So that was another thing they've discovered as well.
All right, but also more focus is to be now laid on reducing hospitalizations and deaths and the successful continuation of the vaccine deployment. How effective do you think this strategy will prove to be?
It's looking at the data and it's looking at the rollout, and that is kind of the core crux of how this phased unlocking will be. So it will depend on that for this to be a success. And if they do notice that sudden rises of spikes, they will close it down. The big concern, I think, for the UK government is the variants, and particularly the South African variant, because it is less effective with the Oxford vaccine. And of course, the UK has got many Oxford vaccinations. So there was one case of they discovered a South African variant just yesterday, and the whole area was locked down. They were very nervous about those variants causing disruption and halting essentially the lockdown.
All right.
Really.
Okay, Mandy, thank you so much for all your inputs on that.